Yeah, it's true. I can. If there are questions, please first state your name and then state your question. No, state who you want to address your question and state your question. Yes, Maria.
Yes, hello, I'm Maria Reicher from Germany. This is for everyone. Anyone can answer that question. It's about open science. We've been talking about the advantages of open science, right? So how about, you mentioned already the predatory journals, that is already a disadvantage. Anything else that's disadvantage? Maybe the funding would be, publishing fund would be extremely high. The sustainability of it would be harder as well. So how do we resolve these issues, the disadvantages of open science? From the perspective of scientists as well, they will be working on it for decades. I mean, that would be, they will be the lack of jobs eventually for them, because it's open. All the data that they have been working for will be open to everyone. So how do we resolve these issues?
Anyone wants to address?
I think the answers can be gleaned from the presentations. For example, the presentation from Kenya, from Ethiopia. It has been pointed out that there's a lot of inequities as far as partnerships are concerned. So that in itself is not a solid and stable, core for pushing for open science as far as lower and middle income countries are concerned. Karel earlier was stating the inequities insofar as there is not enough effort in making sure that the resources of the higher income countries are really benefit the intended beneficiaries. Rose was also pointing out that the difficulties with the lower income countries like the Philippines and Ethiopia, for example, is the inability to have the resources to even access the structures for the country to start pushing for open science. I was actually struck with a discussion from Ethiopia because I was telling him we have so much in common, in the sense that we know for a fact that not just in the Philippines, but I think for most lower and middle income countries, there's not much investment on science and technology, and I think that's basic. So opening the eyes of governments to the fact that the importance of science and technology to developing expertise, to even improving access to open science requires investment. And it's investment not just in not just in putting in money, but really making sure that a lot of effort a lot of resources is being invested in training people. There was a conversation between Rose and myself. I was telling her that the experience of my daughter, who is at the Harvard Medical School now, is a lot of countries are sending scholars. A lot of countries are sending scholars to schools abroad for the country to benefit. And most of the lower income countries do not do that because they're concerned with the day-to-day. It's more inactive, it's more responsive. So it's really trying to focus the help to issues that are most needed on the ground. Because I was telling you earlier that sometimes it's very donor-centered, that and because most of the donors are not on the ground, the importance is on things that are not most needed. So again, I go back to the presentation from Ethiopia that more equitable partnerships are required.
Thank you very much, VP Leni.
Yes, yeah. Thanks for the question. We have to note that the phrase as open as possible, as close as necessary. if we open the data, that means we collect a lot of data, we conduct research, and we publish few from that data. So giving access to others increase the utility and taking advantage others to contribute based on the available data. So when it's necessary, for some time we have to close, but for reasonable time, not for extended long period.
Anyone else who wants to comment? Carol?
Yeah, I just want to put in a pragmatic point to this, in the sense that yes, well, I agree with Rose that putting the infrastructure in place for open science, I mean, even in Europe will cost billions, so that's not going to happen just like this. To find a few low-hanging fruit that can actually make a difference, and I think the RFI is one, which is of course why we're developing it. But the other is, I think, fair data, and I just wanted to emphasize again on this kind of keep it open, keep it closed. What do you do? So if you're not familiar with the FAIR principles, you should get yourself familiar. And the FAIR principles, basically, what they do is they give meta tags to data so everybody can find them, but it doesn't mean they have access to them. The owner of the data still has access. So you need the infrastructure for that, but it's relatively kind of cheap compared to the whole rest of the system. And one of the big objections to data sharing that low middle income countries put up is that they feel that even if you close it for a year, that's not enough. We don't have the analytical capability to make maximum use, to extract intellectual property, to all kinds of things. So then what can you do? Well, the FAIR system would at least allow you to control access to the data and to control who gets access, under what conditions, including co-authorship, etc. And I think, for me, FAIR has lots of potential to be developed, and I would urge high-income country institutions to make sure that in their research collaboration budgets, there's money to make sure that the counterpart can implement FAIR in their setting. That would be a great low-hanging fruit.
Just for those who are not familiar with the FAIR principles, FAIR stands for findable, accessible, interoperable, and reproducible. We can discuss about this later on, but I think Carl has explained it just. Arno, you want to say something?
No, I would like to. I would actually also. I think it should be seen as a note of pragmatism, because I would advocate for as open as possible, as closed as necessary. Also from the perspective of quality, making sure, and you gave a lot of thought-provoking examples, Rosemary, on counterfeiting and exploitation. So we need to be vigilant, advocate for open science, advocate for open data, but we should be vigilant also of the unintended consequences, to actively make sure that they don't take precedence, or that we avoid those, so that we are able to pursue the goal and the dream of a more equitable scientific endeavor. As a fun fact, one of the things that came when we were preparing the Gravitate Health project, if I may, was the discussion and actually quite huge tensions between the public, me as the public partner and Pfizer as the industry lead. Because we were thinking, oh yeah, we do open science, we do open access, we do everything as open as possible. And then it was not so easy. So we established as a pragmatic mitigation the principle as open as possible, as close as necessary, and also to put everything in public domain as soon as we could. But we are one of the projects that opted out of the open science pilot for that specific reason. It was a learning experience, and I'm sharing it as a learning experience and as an example of the tension between public common good, openness, that we are, and maybe even so more so also, that we are fighting for or adhering to or trying to do from a public and academic perspective, and the DNA of relative advantage and making sure that you control what you put in the public domain. So there is some considerations there. Building trust makes progress. So, yeah. But we did it. We opted out as an example.
Thank you very much, Anne. Yes, please.
Hi, good afternoon. I'm Aya. I'm a stipendant, PhD candidate in School in Kubasanya. And I was conceptualizing a research project with a local organization in the Philippines. And I wanted to do it properly and ethically. And of course, there's a process to do that. And what we found out is that there are now ethical research boards in the Philippines, in academia actually, that would review your ethics and you get approval from them. But it was a very difficult process because then this local organization we don't have a lot of funds, and they charge a lot, especially when it's in collaboration with an international organization or an international party. It's cheapest when you're a local student, and even students, they actually charge an amount too. So I would like to know and maybe get your thoughts on this form of gatekeeping, because I think it's very paradoxical that we're trying to do it ethically and then there's a prize in this ethics review process. So
I can say something, but maybe others would want to say something about it first. Karen, you seem to be so into ethics committees.
This has been part of my profession for a long time, and of course I have been once in the Philippines, so I'm an expert on the Philippines. But we work together, particularly with trying to understand how ethics committee function, and there is a basic tension in the world of research ethics. So should we charge or should we not charge? If you charge, you become dependent on the people who pay, and so you're no longer independent. If you don't charge, then, well, you don't have the means to actually do decent follow-up and research, and it is a key issue. So you need proper procedure, proper accountability procedures for it to happen. But primarily, ethics review should be to make ethical review possible, and clearly financing shouldn't be the reason why we don't do that. So I'm not 100% sure about the particular case clearly because I don't know the environment, but we certainly argue that ethics committees should charge, but should charge with responsibly and accountably so they have the means to do so. In Africa, I think we looked around many ethics committees that are the most are dependent on university budgets to do their work, which means that everything gets squeezed. The first one is the ethics committee, and so on. On the other hand, you have, in Uganda, Joint Clinical Trial Center, which people get paid to come to attend to review. It is very professional, it's very high performance. In between, there needs to be found a possibility to do so. So I don't have a solution to your project, but it's certainly not the purpose to make it impossible to get good ethics review.
Right. From my vantage, I want to say that there are different ways to make sure that ethics committees are funded, because we need to understand for ethics committees to function, they need to work, they need to have some funds, right? And I've seen different ways that this happen. One is they ask for payment. I know what you're referring to, and I think they're asking for around $400 to $600 US, if I'm not mistaken. So we're talking about the same research ethics committee. So one way is to really ask the researcher to pay for. But another system is, like, for example, what exists here in Norway, is that it is funded by the state, or funded by, in Norway it's funded by the state. But in other countries it can also be funded by institutions. Right? For some reason in the Philippines we're using the IRB system, for example in the US, who may or may not require for payment. And it's quite unfortunate that they don't really make distinctions in those who have and do not have money for it, and they make a distinction instead of where they're coming from. So which can really be a burden for researchers abroad who are Filipinos who want to help the Philippines. But that is a system that needs to be addressed. I definitely agree. But you have to understand that it's really coming from a very pragmatic perspective. Ethics committees can be very heavily burdened with so much tasks. And the only way that they're able to do that, because no one is really hired to be just an ethics committee member in the Philippines. There are professors doing other things, and then on top of that, do this. Maybe the only person who's hired by the ethics committee will be the secretariat. And I think it's less a problem it's not so much a problem that these ethics committees themselves are unethical, but that we never gave it so much thought that this system is really creating inequity. So, yeah. Tita Luz, and then Aurora.
Thank you. Good afternoon. This is a really interesting afternoon and very larerik. We learned so much, and I would say this is a topic that we do not discuss every day. Okay, and I don't really have a question, but it is more of a comment of my own experience. I have studied law and political science from the Philippines, and my experience in Norway in research is I did an executive MBA in BI. So I did a masteral thesis, and for that purpose I did a research and sharing my experience. And of course, the course is very expensive. I had to borrow money from the Lånekassen, the State Educational Loan Fund, which I repaid for a couple of years afterwards. But research, I think, is, you add to the body of language. That's the result of your work. So this is, to me, why we must be as honest as possible about the results of what we are researching. I think it is very easy to make a little bit, to adjust our results a little bit so that it can please the professor who is my sponsor. Okay, it seems to me when I was writing a thesis that because we were graded, that I would make a result that is a little bit pleasing. But looking back, I think I should put even the negative remarks there, because as I analyze thesis or a result of a doctoral, we must put everything there because we add to the body of language whatever field we are doing. So this is my experience. I have no more years because I'm retired to make a PhD, but I just encourage our kababayan who have all the chance to, try to do it also. I think we have all the chance in Norway, and we have to take the chance. Thank you very much to the excellent body of speakers. Thank you, Dr. Rose.
Thank you, Tita Luz. So that's a reminder to everyone to not perform questionable research practices. Or what you call research misconduct.
Rose.
Sorry.
May I add to that? Yes, I think part of integrity, responsibility, transparency, open science is that we're also seeking to publish non-significant results or the negative, because that adds to the accumulating body of knowledge. And it is important to share it out, not necessarily all that fun all the time, but it is important to share it out to allow the larger community to learn and not repeat the presumably good ideas that didn't come through. And it's also important to analyze why analyze the reasons. And quite often it might be that the design isn't robust enough, and then that should also be part of scrutiny. You may have too few samples, the variation is too big, all these different things. So I would actually just thank you for pointing these issues, for raising the issues and contributing that to this discussion, because it allowed me also to think about the non-significant outputs. Thank you.
Yeah, a reminder, there's a journal for negative results. It doesn't have a high impact factor. But yes, in fact, the point is clear. negative results actually add value to science. I mean, number one is replicability. You don't have to do something that you saw negative results before, right? So it is also knowledge. Aurora?
Good afternoon, everyone. My name is Aurora. I'm a nurse here in Norway. My question is directed towards Dr. Anna. You talked about the gravidate health, which is really interesting for my part, who has a lot of patient contact, which Ms. Rose commented as the general stakeholders, the public. In my decades long experience as a nurse, I noticed that, well, at least here in Norway and in my home country, which is the Philippines, geriatric patients constitute the most consumers of healthcare services. Well, not every time, but I noticed that the older patients get, the bigger their qualms are with regards to new technology. My question is how we nurses, who has the most patient contact, can empower these patient groups. Thank you.
Thank you. Thank you, Aurora, for this very good and important question.
Yeah.
I'm reminded by age and differences in Europe every day. And we in the Nordic do have a high penetration of digital tools. So there are many that are already quite savvy, and the most recent statistics shows that the age group that has the fastest growth in use of digital services is the older people. So few of them are used to it. I think that taking the time, I know this sounds weird in the current environment when we have had all this public press about the lack of time and the lack of quality in geriatric care. But taking the time to find ways to introduce, take time to engage with others to introduce the tools is important. In Gravitate Health, we're talking about the citizen. We want to make a difference for the citizen. We're talking about the patient and the support network. So for those who have a support network, you can actually mobilize resources there. Some years back, I did another study where we were actually exploring the specific question that you raised on how to engage older people with technology. And we called that study Active. And what we actually did was that we were partnering with a youth group that came to the nursing home assisted living facility at regular times. And they met with interested residents and were playing with the tools, which was to us, we didn't think about it before the municipality suggested it, but it came out as a very interesting story of the older adults, the patients adopting the tools, alleviating stress from the nurses, and or time commitments, and also giving the younger generation an opportunity to engage with groups that they did not regularly meet.
Like an intergenerational.
Yeah, it was a trust intergenerational thing. So there are many ways to do this. I acknowledge that in the Nordic and in Norway, we may have we are sort of leading the way. Talking to colleagues in Portugal, very different. Greece, I wouldn't think about Kazakhstan yet. But creative thinking, nurses are creative people. So yeah, I hope that answers your question.
Thank you.
There are two questions from the Zoom audience. First is a question for Ma'am Leni. In what way can first world countries like Norway help in furthering the Angat Buhay program?
I think I discussed this already during the Filipino gathering yesterday. That after Angat Buhay became an NGO already, we designed it in such a way that the many different volunteer groups are more empowered, and the kind of programs that we will roll out are more empowering. We do not want to do a one-size-fits-all kind of thing. That is why we decided that the volunteer groups would not be chapters of Angat Buhay, because every like in Europe or in Norway, who are the communities that you want to help? So top of mind is the Filipinos in Norway. So what do the Filipinos in Norway need? So the idea really is to adapt to the to the community that you want to help, and to adjust the programs in such a way that they will be responsive to the communities that you want to help. So I couldn't say exactly what you need to do, but we are willing to partner whatever it is that you feel like is the most important thing with the beneficiary that you want. May I just add?
Yes.
Because Aurora was saying, was commenting on the presentation of Anne, it was very interesting. I feel like it's a very important initiative, but I don't know with Ethiopia, but in the Philippines it will be very difficult because you are not similarly situated. While the target, while the aspiration is the same. I was thinking while Anne was discussing, how do we replicate this in a manner that will be more responsive to the situation in the Philippines? Because a lot of, not just seniors, but a lot of people in the Philippines do not yet have access to, to the digital world. There's not a lot of skills yet. So I was thinking while Anne was discussing, how do we do something like this that will be more suited to the kind of clientele that you want to serve.
I look forward to discuss that in more detail, actually.
Yes.
And I think that is will be very exciting and inspirational.
Yeah, because one of your slides, Anne, was Maria.
Yeah.
And she was holding a literature of really long discussions of the. So I was thinking we have a lot of people who can read. We have a lot of people who do not have access to the technology, but the aspiration is the same. You want to, you want to educate. So how do we do it? Achieving the same end, but adapting the model to suit the clientele that you want to serve.
Yeah, that's. I think I should be the first to say that I don't know if we can achieve that within the framework of the project as now. But this is certainly something that is important. I think we will learn something in the program that we have ahead of us in terms of taking advantage of the differences in Europe, in terms of digital literacy, of course, in terms of learning how to present. I mean, a video, a series of pictures, pictograms, alternative key messages is important, is strategies to do so. I have been to Jimma, Ethiopia several times. It's one of my place where I have learned and gained a lot myself. I haven't been to the Philippines yet, but one of the things that strikes me when I'm traveling around is the penetration of mobile devices. And I also see when we have students coming to Norway, from different countries, and apologies in advance. One of the first things that I see that they come with, and the first change, is that they get a smartphone. I also know from educational research that one of the surprises and one of the things that sort of, and from healthcare as well, is that the uptake of the smartphone and the medical device, and mobile device, is an enabler in many ways. There is still some land to cover, I realize that. But I shouldn't be too pessimistic. But it is a challenge, and it needs to be, of course, discussed, sorted out, elaborated locally with the people on the ground. What we're trying to do with Gravitate Health is to establish this open source platform as an infrastructure that allows also people outside, or interested parties outside the consortium, to play with our tools as they become available. But there is no way we can do this without partnerships on the ground. So that's the number one. And then number two, I'm quite optimistic when I look at the penetration of mobile devices.
Shireen, a very short question.
It's actually not a question, there's a comment on what was just shared. I'm from Jamaica. I've been in the pharmacy industry, community pharmacy, for a long time. And what I'm really not hearing is the role of the caregiver or even the grandchildren in elderly care. Because I found that a lot, I have to do that, explain about medications, etc. And a lot of times they do have the mobile devices, but their grandchildren are the ones who do the reading and the interaction. So just to insert.
Right. We don't have much time, and I have one question that Carol is directed to Carol. This is a question from Sabi. The question is, how effective are open science practices in eliminating engagement in questionable research practices such as publication and study bias? So the question is, how effective is open science in eliminating questionable research practices, such as, for example, having biased studies?
Yeah. So I think in general, if you look at software production and confidence in quality of software, the more open the software, the more people can access it, the more likely it is that it is not hacked, let's say. I would imagine that an equivalent general statement can be made in open science. The more eyes get over a data set and methodology set, the more likely you pick up both errors, conscious and unconscious errors. So I would imagine open science is basically how, in my learning, that is how science started. You publish because you want to open it up. And I think over the last 30, 40 years with intellectual property rights coming on, that is what constrained most of it, not just in the private sector, also in the university sector. And the open science, as you heard from the Gravitate project, it is tension between those who want to keep secrets and because they think it's more profitable, and those who want to control. And I think open science will create platforms to discuss in general cases how to address that to everybody's benefit.
Thank you, Carol. We have to close in like 4 minutes, but is your question very short?
Yes.
Yeah, okay, like a yes.
My name is Ramon Arcida, a student of the Faculty of Theology of the University of Oslo. And thank you, our able speakers, for enlightening us with global North and global South perspective. And my question is very general and in a way personal. Since you talk about integrity, can you share a situation where your integrity was tested, and how were you able to address this one?
Okay, I will need only one sentence answers from the speakers.
I would like to start. This is not a small question, just to say that. But for me, in my role, what I'm pushing for in terms of open science, integrity, collaboration, transparency, and maintaining trust in the consortium is to balance as open as possible, as closed as necessary, and the fact that although the project is not part of the EU open science, open data pilot, we are committed to put things in the public domain and make it open as soon as possible. I know this was not a statement.
Anyone else wants to say something about it? It seems to be a general question for everyone.
It is a short question, but requires a very long answer.
Yes.
But I'm speaking as a politician. As a politician, my integrity has been tested every day that I was serving public office. I do not want to go into the specifics, but every day that my integrity is being tested, I ask myself, number one, I ask my why. Why am I here? Number two, I ask, how do I want to be remembered? You know, there are short-term gains and there are long-term ones. And the answer has been very clear to me. So it has been very easy for me to hurdle all the challenges.
Fantastic response. Yes, Carol.
Yeah, no, it sounds like a mea culpa session. I think the worst that I had was very recently. The organization that I'm working with is small, is totally underfunded, essentially half broke, and we got a serious grant offer, in the order of $3 million for a 5-year project from the Foundation for a Smoke-Free World. And the Foundation for a Smoke-Free World is funded by Philip Morris. So the question is, do you survive an organization and you think you can do the right thing, or do you don't take the grant and you drop possibly the organization? And we chose the last, which means I'm here without a job talking to you.
All right. So we don't have time for. You think I'm not going to do a medical, but I'm not going to do anything. Okay. No, but of course I have so much faults, and I think everyone does. All right. So, but with that, we end our session for today. Thank you very much. You see, it's been powerful to have a lot of people from the general public. And it's always been the desire, hopefully, of many scientists to have this conversation, not necessarily only with people who are in academia, but most especially for people who are recipients of the results of science. Hopefully in the future, we are not only recipients of results, but actually contributors to the scientific processes. All right, with that in mind, thank you very much for being here, and it's been wonderful being with you.
Just a quick announcement. There's some food remaining there, so if you want to take something home, please feel free.
And there's trash cans in the back. Please pick up your trash and help our team. Thank you.
Say hi muna po sa mga viewers. Ako naman po. Ako na po. Ikaw na. Say hi na lang po sa mga viewers. Okay. Thanks.